The history of COVID-19 deaths is a significant and somber chapter in global history. Below is a timeline that captures key milestones and developments related to COVID-19 deaths from the start of the pandemic until 2019. The outbreak begins, December 2019. The first cases of a novel coronavirus, later named SARS-CoV-2, are reported in Wuhan, Hubei Province, China. Initially, these cases are associated with a seafood market. By the end of December, the first deaths from the virus are reported in Wuhan, 2020. The pandemic spreads globally. January 2020, the World Health Organization, WHO, declares the outbreak a public health emergency of international concern on January 30th. 2020, the first COVID-19 death outside China is reported in the Philippines on February 2nd. February 2020, deaths begin to mount in China, with thousands of fatalities by mid-February. As the virus spreads, Italy becomes the first major hotspot outside of China, experiencing a rapid rise in cases and deaths. March 2020, COVID-19 is declared a global pandemic by the WHO on March 11th. Death tolls rise sharply in Europe, particularly in Italy, Spain, and France. The United States records its first significant wave of deaths, particularly in New York City, April 2020. Global deaths surpass 100,000 by mid-April. The United States becomes the epicenter of the pandemic. With the highest number of confirmed cases and deaths, May 2020, the global death toll reaches 350,000. Lockdowns and social distancing measures are implemented worldwide, though the impact varies. June, August 2020. While some countries see a reduction in cases, others experience significant surges, particularly in the Americas and South Asia. The global death toll continues to climb, exceeding 700,000 by the end of August. September, December 2020, the second wave hits many countries in Europe and North America, leading to another surge in deaths. Global deaths surpass 1 million by the end of September. The first COVID-19 vaccines, Pfizer-BioNTech and Moderna, receive emergency use authorization in December, marking the beginning of the vaccination effort. 2021, vaccination of variants. January, March 2021, vaccination campaigns begin worldwide, but the rollout is uneven. The Alpha variant, first identified in the UK, leads to increased transmission and deaths in many regions. Global deaths surpass 2 million by January. April, June 2021, India faces a devastating second wave, largely driven by the Delta variant. Hospitals are overwhelmed, and daily deaths reach unprecedented levels. By June, global deaths exceed 3.8 million. July, September 2021, the Delta variant becomes the dominant strain globally, leading to renewed surges in cases and deaths, particularly in areas with low vaccination rates. Death tolls in the United States and Brazil remain high, with global deaths surpassing 4.5 million by the end of September. October, December 2021. The Omicron variant is identified in South Africa in November. While it spreads rapidly, early data suggest it may cause less severe disease, though deaths continue, especially among the unvaccinated. Global deaths surpass 5 million by December 2022, endemic phase and ongoing challenges. January, March 2022, Omicron continues to cause waves of infection worldwide, but with lower mortality rates compared to earlier variants. Global deaths reach 6 million by March, April, June 2022. Many countries begin transitioning to managing COVID-19 as an endemic disease, relaxing restrictions and focusing on booster vaccinations. The disparity in vaccination coverage leads to continued deaths in low-income countries. July, December 2022, the global death toll gradually slows, though the total exceeds 6.7 million by the end of the year. 2023, continued impact and new variants. January, June 2023, new subvariants of Omicron emerge, but with even lower mortality rates due to widespread immunity from vaccinations and prior infections. The WHO reports that while deaths have significantly decreased, COVID-19 remains a major cause of death globally, particularly in vulnerable populations. July, December 2023, global deaths reach 7 million by the end of the year, efforts to develop next generation vaccines and treatments continue. 2024, a new normal. January, June 2024, COVID-19 is largely managed as an endemic disease, with sporadic outbreaks and localized increases in deaths. Global deaths continue to rise slowly, now exceeding 7.2 million. The WHO and other global health organizations emphasize the importance of ongoing vaccination, particularly for high-risk groups. July, September 2024, the world continues to adapt to living with COVID-19, with a focus on preventing severe disease and death through vaccination and treatment. Deaths from COVID-19, while still occurring, are significantly lower than at the pandemic's peak, reflecting the effectiveness of ongoing public health measures and medical advancements. Conclusion: the history of COVID-19 deaths reflects the devastating impact of the pandemic on global health, economies, and societies. As of 2024, COVID-19 remains a significant health threat, particularly for unvaccinated populations and those with underlying health conditions. The global response to the pandemic has seen both triumphs, such as the rapid development of vaccines, and tragedies, particularly the high death toll in countries with limited access to healthcare. The legacy of COVID-19 will likely shape public health policy and global preparedness for future pandemics.